Well, good afternoon, everyone. Sorry for the slight delay. We're just having a technical difficulty with one of our panelists, but hopefully he will be able to join us. So welcome to this COVID-19, the recovery stage, a gas safety a special. This webinar is the third in a series that's been put together by Fusion21 to share with members and others how the sector is preparing to enter the recovery stage of this terrible pandemic. The first session took place back on the 12th of May, and we held an asset special, which many of you may have attended last week. And next week, we'll be focusing on compliance, and in particular on water, asbestos, and the other compliance issues. But today the focus is very much on gas safety. If you've missed any of our previous webinars, they are all available on our website, fusion21.co.uk/events. For those that don't know, my name's Andrew Gray. I'm the Member Relationships Manager at Fusion21. And now it's great pleasure to introduce our panel. First, we have Sam Browne, Client Support Director at CORGI Technical. He'll be supported by Joe Beesley, who's Technical Safety Manager at CORGI. Then, hopefully, we'll have Pat Coleman, who's Managing Director at Shore Maintenance. And Pat, together with Steve Harrington, who is Head of Compliance at Great Places Group. And then finally, we have Keith Rogers, who's Category Manager for our Heating and Renewals team at Fusion21. So it's a big welcome and a big thanks to our speakers. We do want to hear from you, our audience, and hopefully you are hearing us all right. I understand that one or two may have a little issue with sound, but hopefully you can do that. You should be able to, on the control panel on the right-hand side of your screen, be able to adjust the changes and deal with those issues on this right-hand side of the screen. So, without further ado, I'm now going to hand over to Sam and Joe Beesley from CORGI Technical, who will go through their presentation. So, if I could hand over to you, Sam.
Thanks, Andrew, and good afternoon, everybody. We're delighted and really pleased to be invited onto this webinar today. I'm sure, as it has been for everyone listening, it's been a real challenging time for us all at ASCP and CORGI Technical. We've frantically been working hard to keep our members and clients up to speed with all the recent changes and announcements. And you know, since mid-March, when we paused our on-site auditing services and lockdown really set in, the communications from the various authorities has been pretty fast-moving, and almost on a daily basis, the messaging has changed. And being the voice for providers of approximately 3 million homes in the sector and listening to their concerns, it was clear that ASCP, the Association of Safety and Compliance Professionals, that we needed to campaign government for an extension of 3 to 6 months on the required gas safety checks. And whilst pushing HSE hard for this, we continued to tirelessly work to support the members, help them by sharing the best practice processes and procedures that they developed. And it really has been fantastic to see how the sector has pulled together and supported one another. We've surveyed our members on how they've been impacted, which has provided some fascinating insights, and Joe's going to share some of that with you shortly. And now that things are beginning to open up a little more and these new procedures are becoming the new norm, we are currently collating the response to a second survey to better understand how the providers are now operating and coping, and we'll look forward to sharing that with the sector as soon as we can. So I'll hand you over to Joe, who's going to present the timeline of events and some of the key findings from our survey, and also talk to you about how the sector has adapted already during this initial recovery period. Over to you, Joe.
Hello everyone as well. Andrew, are you able to give me control of the slides, please? Thank you. Okay, so sorry, bear with me one moment. The option to change the slide doesn't appear to be there. Andrew, are you able to just move them on as I say so?
Yeah, sorry about that. Yeah, you should look. Yeah, if
okay, just take us to the first slide. Is that done?
Yeah, you should have that now in front of you.
No, unfortunately, I don't. What I'll do is I can get the slides up on my screen. Sorry about this, everybody. We did practice this when we were trying the system, but best plans go to waste and all that. So what we wanted to do is just recap over what we had gone through to get to this stage in the first place, and obviously some of the questions that organisations will now be asking themselves in regard to the recovery. There's always a dilemma of issuing with the balance between obviously landlord's duty of care with regards to compliance regulations and making sure that their tenants and workers are safe. Able to move to the next slide, please, Andrew. Here's the COVID timeline, which is obviously showing that over a very short period of time, I've got control of that now, that since lockdown there was a rush of information issued by government, regulatory authorities, the HSE Gas Safe Register, and there were so many questions that remained unanswered, but over time they were answered. But as Sam illustrated before, there was such a rush of information and people trying to work within the guidelines and interpret what was best practice and what was the balance to make sure that everybody was working safely. As we can see there, we've gone from the lockdown to now in the stay alert phase, and obviously we've got whatever comes next in 2020-21 until the new norm is established. One of the things that we did, we launched our campaign for COVID compliance, and that was based on some of the discussions we've had with our members and customers, and we just wanted to be the voice for the sector again and put pressure on the government and regulatory authorities to try and make the right decisions and informed decisions. We were really successful and able to engage with government at senior levels in all different ministerial departments, just to have the issues that social landlords were facing on a practical level. We actually managed to contact many MPs and customers to get a good consensus of what was realistic. So what was the potential impact? So we know there's approximately 5 million social homes across the UK. Looking at that over a 12-week period, that would result in 1 million routine gas safety checks carried out. And if we take that in the wider context of emergency repairs, reactive repairs, and those safety checks, we're looking at around 3 million social interactions just as we were going through an outbreak of a potentially deadly virus. Couple that with the compounding issue of resource, where operatives, support staff, engineers may be off work due to illness or self-isolating in accordance with the government guidance, it gave social landlords a real difficulty in deciding what action to take and what resources to put in place to maintain gas safety across their portfolio. So we didn't just base our campaign on figures or information plucked out of the air. We actually were quite well placed to look at our clients' housing requirements and what their assets conditions are. And we know that gas appliances in social housing are the safest in the UK. They are regularly serviced, they are replaced at the end of their life cycle. And it says many properties are carbon monoxide, but I would say that the majority of social housing properties will have carbon monoxide detectors as that second layer of assurance. If we take that in contrast to what we've got in the private sector, private rented and private owned, it's vastly different. So we can say that social housing properties in respect to gas safety are going to be among the safest in the UK. So could that allow for a different approach? Well, we felt, and our members and customers felt, yes, it could do. And we looked at that and decided that the things that we would try and tackle were very non-emergency work being suspended. With LT checks, a temporary short-term extension granted, 3 to 6 months, so that landlords could deal with the backlog. Relaxation or a light touch approach by the regulators regarding the safety of gas safety checks. And housing providers obviously still need to maintain their appliances and installations in a safe condition and would allow tenants the right to request a gas safety check. So all these things are things that we're pushing for and we'll try to be the voice of our members. We managed to get in touch with 104 housing providers that gave us support for the campaign and over 20 MPs. And as you can see, thanks to the hard work and dedication of our chief exec, we managed to get in touch with the top level of government and got responses from them and put pressure on at the right time and in the right places. Subsequent to that, we did get some guidance from the MHCLG, and what they said is that they understand the difficulties landlords were going through in respect of resources and access, but they did reiterate that they would not be unfairly penalising landlords on there, and they were going to take a pragmatic approach. That could be interpreted as a light touch, but the proof will be in the pudding. One thing they did reiterate again is that landlords must demonstrate that they've taken all reasonable steps to gain access. That comes up with Regulation 39 in the Gas Safety Installation and Use Regulations, in that there is an exemption to liability. It should be part of any landlord's standard access procedure, whether you've got a COVID break or not, in trying to gain access to a property, you would need to demonstrate that you've taken all reasonable steps so that you're going to use this exemption to liability. That may involve some additional measures regarding COVID-19, such as if a tenant informs you that they are self-isolating or shielding, it's following up after the containment period to ensure that that is over and that you can now gain access and safely carry out any compliance checks that you need to undertake. As I said before, that should be part of any robust access system already. One thing that was welcomed by the sector, and I know I personally was thankful to see it when it first came out, was some very clear guidance from Gas Safe Register. Different scenarios and what was expected of gas safe registered businesses and also landlords in respect of gas safety, whether the occupants be clinically vulnerable, shielding or safe isolating, and how social distancing may play a part of that. One of the things that did come as part of obviously the rush of information that was put out there was the scenarios that they had mentioned, and I think the term there is to try and carry out the check early. But we know that social landlords will already be trying to check early by gaining access 10 to 8 weeks before the anniversary date. Subsequently, they did release an update to that guidance and that was taken out. But they did say that all of the above would apply and risk assessment for landlords to ensure that they are able to demonstrate that trying to gain access to these properties to carry out the safety checks. Obviously, more information came out from the regulator of social housing. They conducted their own report, and there's always going to be a bit of a lag between when the information is gathered. And they did undertake a survey in April and then a second one in May and release that data in June. Now, on the side of the, you can see the comparisons. As you can see, the notable one that has shown a significant drop in landlords being able to complete all their safety checks or maintaining staffing levels is gas compliance. The other areas of compliance and support staffing levels seem to have either improved or remained steadily the same, whereas gas compliance checks seem to have declined. Now, that would indicate that landlords have used up the buffer that they had in place, which is the 8 to 10 weeks, and are now on the breadline of trying to get in to do those checks. So it's important that government and regulatory authorities understand this so that they can apply their duties accordingly. We conducted our own research and we spoke to roughly 100 social landlords that are in control of just short of 2 million homes on there. And while on the face of it, access figures on an average were down by 16%. If you look further into the detail of the data that we collated, nearly a third of social landlords were operating at access levels of less than 60%. Some of those averages will be mitigated by people being at home, whereas they may have previously been at work or out more, so those that were difficult to access for those reasons became easier to access. But when we compound that again with the engineering capacity, that we found again almost a third of landlords operating with an engineering capacity of less than 70%. So at the same time as we've got restricted access because of social distancing, safe isolation and shielding, we've also got a reduction in the capacity to keep up and recoup some of those losses because our engineering capacity is down as well. And this presents another problem for landlords when they're considering what the next steps are going to be to recover. Positive takes that we got from that though was that 35% of respondents ranked team spirit and commitment and resilience as a #1 positive takeaway. I know from our internal dialogue and communication with clients that there really has been a push and everybody stay positive and come up with some really innovative ways to combat the issues that are being forced upon the sector on there. And I know that most clients that I speak to say that the #1 thing is that they've got a good quality contractor that works with them as in a partnership so that they can actually make sure that their tenants are safe. We just wanted to look at some of the questions that landlords will be asking themselves now when they decide how to come out of the first phase or second phase and start to look to recovery. And those are going to be, what services can or should resume? What are essential services that we must keep up to date with? What are the non-essential services that we can reintroduce, and when should we reintroduce them? Once we've decided what services we're going to reintroduce, have we got the resources available? Are we going to be able to deliver it? I know we've got some customers that I've spoken to where their contractor unfortunately shut shop completely when the lockdown came into effect, and they were forced into finding alternative provisions, new contracts, new ways of working, unknown entities, so that they could deliver gas safety compliance checks for their tenants. Have we got the resources available to meet all of our obligations as we come out of this in the staged approach? Once we've done that, then we've got to consider we're going to implicate these services, but how do we keep to the social distancing requirements? Again, it's balancing that act of maintaining gas safety, but also making sure that we don't contribute to any sort of a second wave or increase in numbers of the COVID-19 virus. One of the key things that I know our clients have said to us and when we've spoken to tenant groups is that information provided from landlords to tenants or from government to tenants has been really helpful. Those that have got effective information communication channels have been the ones that have been most successful in maintaining their access figures. Something that we managed to get from the Social Housing Resilience Group was an example of a route map that some landlords are considering and putting in place. And this is just an effective way of mapping out what you're going to be able to achieve during the different phases of recovery and resuming your impacted services. This can be used to communicate to staff, tenants, other interested parties, and gives a very clear outline of what we are going to be able to achieve. So as you can see, during lockdown, non-emergency repairs, absolutely no, they cannot be completed. But we may have cyclical maintenance such as gas safety checks that yes, they can be completed with tenant consent and controls. As we move through the different phases and lockdown measures ease, obviously more services will be able to come back into play. So it's just an example of a good way that landlords can demonstrate how they're going to recuperate from the impact. We've also got to consider the COVID alert levels, and any changes or resumption of services need to have something built in that will determine what steps to take if there is an increase in the COVID alert levels. I will hope and expect that the alert levels will decline over time as we move into a lower reproduction rate in the community. But we've got to say that there is a possibility that it could increase. And planning now for how you will tackle that if it happens is going to save a lot of pain and heartache in the long run. So that's something that we'd like to see more organisations doing, is looking at how they would address the impact of any increase in COVID-19 again. Most clients that I speak to and customers have updated their business continuity plans. Yes, they are looking at the positive and negative changes to the alert level. Most registered social landlords have used all of their buffer, 8 to 10 weeks, and how they're going to now look at bringing that into fruition. And as we said, we've got restricted access, potentially the level of resource level as gas engineers. So the opportunity to increase the capacity, which you would normally want to do to build that buffer, is not going to be there, which tells us it's going to be quite a long time before we return back to the types of levels that we were used to. And are we obviously taking steps as a responsible social landlord to mitigate any second wave infection in the community? We've got a duty of care, not just to the individual tenant, but most social landlords are the heart of a community. So they need to obviously take care on the wider scale for things. So any changes that people are looking to make need to be smart changes. And what I mean by that, they need to be specific. They need to be outlined, detailed and written. To be measurable. How will you measure improvement? How will you measure meeting those KPIs and showing that you've achieved your targets? Again, they need to be achievable and realistic. There's no point setting yourself up a target if you know it's absolutely not going to be able to be achieved. And there should be time bound as well. We should set time limits to say when we're going to achieve this and how we will define whether that's been a success or a failure and what we can learn from. So the wheels do seem to be coming into motion. I know it seems to be picking up at the moment, and especially I think July. There's a lot more work being planned to be released in July for everybody to get on with. And that's just demonstrating again that I think the sector has shown a significant determination and commitment to keeping people safe with respect to gas, but also looking at the COVID-19 impact on that. One thing I would say is that the sector that I've spoken to, again, has been very positive and taken all steps, and people have been working very hard to make sure that gas safety is addressed during this period. Okay, I think I don't know if Sam's got any words that he wants to add.
No, that's great, Joe. Thanks. I think you know, as you can see, it has been a very busy time, but a lot of information there. And you know, I think like everyone else, we're learning all the time and developing what we do, and we're adapting to the changes that we're facing. And it's great to work with the sector along those lines. With CORGI Technical now, we are back up on operating in the field with our audits, and our membership with ASCP has never been stronger. You know, we've really bonded together with our members during this time, so we can hang around after the other presentations to answer any questions and queries that you may have. But contact details are there if anybody wants to drop us a line directly and discuss anything or set up a consultation. We'd be happy to take that on board. But thank you very much for the opportunity, guys.
Yeah, thanks very much, Sam and Joe. Just very quickly, we've had one question from the audience, and audience, please do feel free to send in further questions. But the question is, cancelled appointments as a result of COVID-19 concerned, whether or not that be self-isolation, shielding, or basically somebody just not wanting to let you in for fear of the operatives. And can that be classed as an access attempt in terms of the regulator?
Yes, if you've had a pre-arranged appointment and you've attempted to gain access, then obviously it should be documented that you've had that appointment and you've tried to get access. And I would also highlight the reason for the denial of access. Obviously, if somebody is self-isolating or shielding, then you address that in a different way than if somebody says they don't want you in because of the risk, but they're actually perfectly healthy in themselves. And a lot of social landlords now are taking different approaches to this, and some are increasing the level of PPE protection to give that level of tenant assurance, so that yes, they can go into properties and will go into properties where there are no actual symptomatic isolating or shielding people, just to give the tenant assurance that they're not going to get the transmitted disease.
Okay, that's excellent, and that's, you know, that's potentially that's a great segue into our next two presenters. So again, it's really good to hopefully now hear some of those sort of practical issues. So hopefully we've managed to sort out the technical issues that we've had with Pat, and Pat is also going to be joined by Steve Harrington from Great Places. So Pat, hopefully you're there, if you can unmute yourself.
Andrew,
hello, Pat. Yes,
yeah,
we can. Great, excellent, thank you.
Apologies for that. I've had some fun and games with my laptop. I had a laptop breakdown on me yesterday and a brand new today, which I've had fun and games with. So we're finally there. Andrew, do I have control of the screen now?
You should have, yeah. Great. Or if not, just shout and we'll take it. But if you click on the presentation, you should now.
Okay. Hello, everybody. My name is Patrick Coleman. I'm the Managing Director for Shore Maintenance. And we've been asked to give a short presentation on how we work in partnership with Equity Housing and Great Places and Fusion21 to deliver compliance. I'm sure we all agree it's been very testing times that we've been under, and to maintain compliance and try and improve on it, it's been a big task. So how we maintain the compliance? Sorry, can I go back one there, Andrew? There we are, yeah. So from the start, we've worked closely with our clients. We sit down at the very start of the COVID-19 situation, and we decided how we were going to approach this from a compliance point of view. And that included redesigning our access letters. So we had the correct wording regarding PPE and giving people plenty of opportunity to rearrange appointments, and just really keeping them in the loop with everything that's going on. I think that one of the main, we wanted to sort of really put across that we were concerned about the customer journey, because obviously the concerns with the customers and with the clients regarding this. So we sat down, we sorted our business continuity plan out. We shared that with Equity Housing staff. We shared that with all our clients. And through that, we've explained the procedures and safety measures that our engineers will be taking. So wearing the PPE, the gloves and face visors, basically the way we spoke with clients as well, we spoke with customers to actually inform them of what route we're taking. So if we start first of all in our telephone procedure, I'll go over the lettering procedure in the next couple of slides, but obviously we're fully concerned that people would try to make appointments over the telephone, and we needed to be clear and concise on the message that we were putting across to them. So a phone call would come in and the help desk would take that call. And first, there's a set list of questions that we would ask them regarding COVID-19. Obviously, we're concerned that we've got a duty of care to our own employees as well, to make sure that they're safe and they're working in a safe environment. So questions were asked around the COVID-19 to see if they've got symptoms of it, high temperatures or continuous cough. Is there anybody in the household that had confirmed cases of coronavirus? And what duration of self-isolation, if there was, has been recommended. So if you go over to the other side of the screen there, then if the answer was no, it's straightforward, we continue. But if the answer was yes, we advise the customer unable to attend until the self-isolation period was completed, and get the most recent contact details so we can keep that lines of communication open, and then update our systems. I'll show you in the further slide of a spreadsheet that we keep to make sure that we track the actual appointment. So we've got an audit of it. That was for the servicing. Also in the lower box, you can see that's the same sort of process for repairs and installs. So when we deployed an engineer for the servicing, so prior to the engineer actually attending, he or she or our help desk would phone the customer just to make sure there's no change in the circumstances. Obviously, if the answer is no, then we continue. If the answer is yes, then we'd go on and ask the customer if they've got heating, hot water, and basically just make sure that they're comfortable with everything that we're doing, and we complete the no access procedure until a further appointment's made. So when we deploy the engineer, prior to attending the property, again, we would go through the same procedure, phoning the customer, make sure that nothing's changed. If it has, again, ask the customer the details of the repair. Engineer was to advise the customer of technical advice, see if they could complete, if it was a simple repair that they could do, room start was down, even no gas, we've all come across it. And again, complete a no access procedure, but keep it in the data and keep it in the format that we're tracking it through. And then deployment of the engineer is when everything's been agreed and everybody's safe, that we can get the engineer to attend the property. On to the next slide here. Like I say, we've always kept customers informed, and I think it's the big thing is that really for their peace of mind is to know that we carry PPE, we carry all the relevant PPE, face masks, gloves, the full white suits, and we communicate that with our clients and with our customers to make sure that everybody's comfortable with that. We've had a range of requests from customers on what PPE they think we should be providing, which is fully understandable. Some don't want you in the full white suits because they fear that their neighbours would think that they've got coronavirus, which is completely understandable. But the basics are always adhered to. So the actual fact that they're wearing the masks, the gloves, and the face shield where possible. And again, this is always communicated with our clients. We also, with Equity Housing in particular in Fusion21, we share information. We're fully appreciative that a lot of clients have their own DLO or another contractor doing building work. There will be information coming from that side which needs to be shared with the gas contracts as well, and that's updated on our system as well. So this is the spreadsheet that this is an example of a spreadsheet that we keep on our system. So basically it's giving the name and address and postcode of the customer, the reason for the no access or for the self-isolation, and we track that through. The start date, we always ask the customer when the start date of the isolation was, so we can track it from there on. If it's a 2-week shielding, then we put a date, we agree a date in for the servicing. If it's longer than that, we then speak with the customer to see if we can get a date, obviously prior to the expiry date where possible. What we've done as well is we make sure that we get the appliance details, and certainly with Equity and Great Places, the reason for this is then we can risk assess it really to see what type of risk it holds. So we know the make and model of the boilers and appliances in there, and then we look. So if it's got a boiler and no gas fire and no gas cooker, we class that as a low risk really. If it's got a boiler and a gas cooker, we would class that as a medium risk. If it's got a boiler and an open fluid fire, we would class that as a high risk. What we've done in agreement with Great Places and Equity as well is where the customer is sure that they're not going to let you in, but we see that there is a risk there, we've agreed to leave a CO detector on the step by the door that the customer can fit themselves, just to give them that added value really, and added expectation that they're going to be safe. There is more details on the spreadsheets because we then track it for no access, so our clients can have a complete view on when we've attended the property, and any no access is there then from there on. So the communication obviously with the servicing starts with the pre-service letter. So as always with the date and time of a proposed visit on, and what we do is on that letter, it's to be honest, it's different for every client, but we have a short paragraph detailing that all our engineers will wear the required PPE. They will adhere to 2-meter distancing, and they will clean down the property or the surrounding area where they've been working after their job, and that gives the customer a bit more assurance that they are then safe. Again, this applies to repairs. It's that communication, making sure that the customer is kept up to date with everything that's going on, making sure that we're asking the relevant questions about the symptoms. Do they know anybody who's had the symptoms? Have they been in contact with anybody who's had the symptoms? And getting a view for ourselves on the potential dangers of entering the property. So what we've agreed with a lot of our clients is that if we go into a property within 12 weeks of its either expiry date or its agreed service date for a repair, we will then carry out the service. And the reason for that, obviously, Steve will mention it, we get a lot of clients or customers who are shielding, and they just don't want to let you in the property for various reasons. However, obviously, when the boiler breaks down, that's a different matter, and they do want you in the property. So we use that opportunity then to carry out the service as long as it's within 12 weeks. We also employ customer liaison officers on all our contracts, and they're a key thing for us, really, because I think that interaction that they can have on a more personal basis over the phone, giving assurances, making people aware that we are fulfilling all our obligations regarding PPE, and just that listening ear sometimes, it really does help us out. And that helps, that certainly is, on equity, has helped us achieve our 100% compliance. I'll hand over now to Steve if you're ready. Thanks for everybody's time. Steve, if you want to carry on.
Steve, I'm just handing the controls over to you. Just in terms of, there's been a sort of couple of questions, and I'm not sure if you'll address them, and if not, then perhaps at the end Pat can come back. So I'll just sort of summarise a couple of those questions. One was on whether or not you provide CO2 alarms. There was another question on how are you approaching the catch up with, obviously, if you've not been able to achieve all of the safety and checks, how are you going to deal with catch ups, and also the process that you're adopting when a tenant is shielding and that 12 weeks takes them past the due date. So again, hopefully you can address some of those. If not, I'll pick up those further questions in due course. So hopefully, Steve, you can move the slides forward. If you click on the slide, it should move forward.
That's me. There we go. Hi everybody. Hope I'm clear enough for you. The reason I'm sort of on here is originally I was working at Equity Housing Group, where we have a contract with Shore Maintenance through Fusion21. But Equity has only got about 2,000 properties within it. And I moved over at Christmas time to Great Places Housing Group, where we've got another 12,500 properties, and the two companies then merged together. So I sort of led the way, and then the companies merged in April. So we've now got, 12, 13, 14,500 properties. Somebody earlier on mentioned about resilience, and one of the things that comes across well and strong here is we've got gas teams in both organisations who had a really, really good track record. In Equity, it's been 100% for about 9 or 10 years. In Great Places, it had gone 4 years, 51 weeks. And at 4 years, 51 weeks, we suddenly started getting properties that went out of compliance. At no point during the pandemic have we ever dropped below 98.7%. But what we did have was a number of properties that were telling us they were self-isolating or whatever, and we'll come to that in a second. But in terms of the numbers that we were getting, we went from the beginning of March at 0 to it sort of almost flatlined up to about 40, went up dramatically during the back end of May to 160 properties, which is about 98.7% for us. But it's then dropping down equally dramatically. So, like we see these government graphs every day of deaths in hospital, our LGSR expiry graph is looking exactly the same. what is quite clear is that what we did in the first few weeks sort of used up the balance of that 4, 5, 6 weeks in advance bit. So we all had that buffer, and that buffer started coming in at the beginning of at the back end of March. By the time we'd got 4 or 5 weeks into it, the buffer had exhausted itself, and we were then getting hit by no access. In terms of why we have no access, I've got to go back to the right screen. In terms of the reason we were getting it, we started off in back end of March, and we looked at how many customer contacts were happening. And we know, and CORGI have already mentioned it, but in terms of ourselves, and this applies to everybody, never mind in terms of millions, which is overall, every day we have every engineer, they visit normally a bit more than 7, but they normally get in 7. We were told that they might go 5 days before they get symptoms. We knew at that point in time we got 10 engineers on site, and between us we'd gone from one contractor to another. We actually did a mobilization in the middle of the pandemic, but what we were reckoning was all those contacts each week. So we've got engineers going into 350 of our homes, 350 households every week, with the potential of either an engineer who'd got the virus passing it out to everybody, or the potential of all those customers who might have it passing it to our engineers. Either way, it's not what we wanted to do. So one of the first things that we did was back in end of March, we decided to slow down the process. We knew we were working on a 10-month cycle. So we decided, right, what we're going to do with both contracts, we were going to stop all new appointments, and we were going to reduce all those visits that normally take place 7, 8, 9 weeks before failure date. We'd stop those happening. And so all we would focus on was the properties that were going to fail in the next 3 or 4 weeks. And we did that quite deliberately to buy us a bit of time, and hopefully buy the industry a little bit of time, because at that point we were starting to look at, well, how can we adopt what they've done with MOTs, and we were desperately hoping that the HSE would give way a little bit and allow us to put some back. When we looked at it and we started seeing the numbers starting to increase, in the early days, what we tended to get was just the people who said, no, you're not coming in because I've got the virus. And we got a bit of that. In total, against all of our stock, we've only ever got to about 20, 25 people who have told us that they're self-isolating. The majority of cases, we get these type 1s, as I'd call them. These are the people who think they might have something. And they're following the government guidance. They don't want to pass it to anybody else. We're very grateful for them for telling us that. The second group are those people who are self-isolating because they're in a high-risk category. So these are people who, they might be, my mum who's in her mid-80s, it might be somebody who's got a medical condition, might be somebody who's just come out of hospital, and they are terrified of getting the virus. There was, if you recall at the time, it's calmed down a little bit now, but back into March, the media frenzy, as it was all about, if you get this virus, you're going to die. It was almost as blunt as that. Nobody, you know, we look at it now and think, no, it can't have got that bad. It really did. The media frenzy at that time was, you must not get this virus no matter what. You must stay indoors. You must do this. And that's all very good. But what we were getting was a lot of people who didn't want it. We also got a lot of people who don't want the virus, who didn't actually think it necessary to talk to us. So if we have 20, 25 people who tell us about it, we were then getting another 130, 140 people at the worst time, where they were not responding to anything. It didn't matter whether we were ringing them up, emailing them, texting them, writing to them, whatever we did, those people did not want to make contact. They weren't telling us that they were self-isolating. So, you know, it's fine to record these things, and we'll come to that in a second. But these were people who were in the complete, did not want to communicate. And we knew there were some issues that were affecting us as well in terms of how we were getting in. So we knew that there were a number of issues. One was about the number of available engineers. Well, actually, that didn't really affect us, because the contractor we were using always made sure they'd got enough engineers on to do the servicing that we told them to do, bearing in mind that we'd reduce the servicing levels. And as we mobilised the new contractor and Shaw came on board, if you also remember, back in the day at the start of all this isolation period, we were in a little mini summer period. So the number of breakdowns was dropping like a stone, and we suddenly found ourselves with enough engineers to do as many service visits in a day as we possibly could ever want to do. We had an issue with reminder letters. We, like majority of RPs and local authorities and ALMOs, we all send out loads of reminder letters. So the contractor has a go first and does their 2 or 3 letters. The contractor leaves postcards through the door and uses tenant liaison officers, and all that goes on. But then it comes a point when it comes back to us as the client, and we then have to start sending letters out to everybody. Well, one of the negatives that we might have had, and we certainly did, is that for us to send out those reminder letters, we need to have working systems. And just something as simple as it was, yeah, we've got staff working from home and they're able to access our online databases, but are they able, working from home, to print letters? Are they able to print the letter, get it into an envelope and into a franking machine and sent out? So we realized that actually in that first few weeks we were going to struggle with that. People weren't wanting to leave their homes to go to the office. We've ended up changing it now that we have somebody goes into the office once a week for 2 or 3 hours just to put those letters through, because the technology wouldn't allow us to do it from home. We had an issue of staff not visiting homes. So we've got a number of our staff, you know, all our housing staff, and they're basically working from home, and we don't want them going out, potentially getting contaminated or spreading it. We've always tried to reduce the number of visits to people's properties to just that's essential. So an engineer getting in to do a service, yeah, that's essential. Somebody knocking on the front door, going door by door, we really did struggle with the idea of asking people to go and do that. So between the reminder letters not going out for that 3 or 4 weeks and staff not visiting for that 3 or 4 weeks, I think you put the two together, and that did have an effect to us. And I've already mentioned about the self-isolating people. What do we do about it? Well, what we've been doing is recording all calls, so or logging all calls. So whether it be the contractor getting a phone call back from the tenant or us getting a phone call back from the tenant, in both sides we record it. We record it into a spreadsheet. We record as much detail as we can do, bearing in mind the vast numbers of these that are going on. So we're recording them, any refusals on the door. We keep those notes, we date the notes. So we've set this up and we've tried to then put something in place that's manageable. And I was a little bit bothered by some of the guidance that comes out that says, oh, if you risk assess it, well, to be honest, what does the risk assessment actually allow you to do? And when you read, well, if it's a low risk, well, maybe you can postpone it. But the guidance still seems to be, yes, you can postpone it, but only up until the expiry date anyway. So if you've got somebody who says that they're self-isolating for 2 weeks, 3 weeks, yeah, you can postpone it that 2 or 3 weeks time, but then you've still got to get back in and you've still got to get into that property. So the risk assessment doesn't actually do a great deal, other than perhaps what we looked at was, well, which are the higher risk properties? Well, quite clearly I would have thought an open fluid appliance. We've still got a couple of old BBUs in place. Thankfully, it's only a couple. So those properties much be a higher risk. Lower risk maybe would be the room seal boilers. We know that these boilers, in the majority of cases, are less than sort of 15 years old, majority less than 10. They're a room sealed appliance, they're well maintained, they're looked after, you know, the modern appliances. So yeah, much lower risk. But what can we do with it? And the main thing with the risk assessment, I thought was in about what we actually talk to people about. So if we're actually communicating with a tenant who says they're self-isolating and they've got an open fluid fire, then we ought to be saying to them, well, you know, because of this, because it's not been serviced, please don't use your fire. If you've got any concerns, give us a shout. We'll come out and do it. We'll use the PPE, but in the short term, please don't use it. We've asked the contractor, and the engineers have gone out with CO alarms. We don't have CO alarms automatically in every single property, but this is you know, one thing that we can do to reduce some of the risk, to mitigate some of the risk, is give out CO alarms at this point in time. So even if it's not the standard practice to fit them, you know, a number of RPs don't, then we give them out so that if there is a problem, you can get on the phone to us, or more importantly, get in touch with the emergency number first, and get yourself made safe. So we use that risk assessment a little bit to influence the script that we can use. In terms of bringing it forwards and catching up, one of the things I'm quite concerned about, and I've mentioned already, is what the messages in the media are. We're no longer led just by watching the BBC News or Sky News or whatever. We're led more by social media, by Twitter, by Facebook, by link, you name it. There is so much truth, as it were, out there. There's loads of mixed messages, and when we think back to where we were just that couple of months ago, everybody was frightened to death, and a lot of people are still frightened. I've seen messages coming in from customers that say, if it's a choice of being taken to court for an injunction, or you coming in doing your service, or dying, I want to stay alive. So me staying alive is you don't come in my property. They don't twig, I suspect, that the far more risky of some incident happening because they're using a gas fire that's not been serviced properly, I suppose. But there was a definite coronaphobia around a couple of months ago, and that is still there. It's getting better. One of the things that I think we're seeing at the moment in my little graph that I use every day is that we are getting in more and more properties, and whilst that number of outstanding LGSRs was increasing, it reached its peak about 2.5–3 weeks ago, and it is definitely dropping now quite nicely. We've put letters out that seek to reassure customers about what PPE we have in place. We've also done an email message to all of our customers telling them what we're doing, and we're also then looking at what possible campaigns can we do. So, you know, we're now wanting to look at restarting injunctions, but there's a problem there that a lot of the courts aren't really wanting to work with us at the minute. One of the things I want to really push is get everybody lined up for doing our own media campaigns and pushing it out there as much as we can. And yesterday I saw the first advert on LinkedIn for Gas Safety Awareness Week, which is in September, and I really wish it was in July. So I think we'll be wanting to really hammer into that, and that's what we need to do, I think, going forwards.
Okay, that's great, Steve and Pat. Just a couple of very quick questions. One directly for Pat. Is there a temptation to pass on the PPE costs to your clients? And then one specifically for Steve around that CO2 alarm issue, in terms of, you know, are you making sure that they are fitted correctly, or are you just leaving that to tenants to do?
Well,
do you want me to answer? Sorry, Steve, go on, mate.
Sorry, dealing with the CO alarm, if the tenant won't let us go in to do a service, they're not going to let us go in to put a CO alarm up. All we can do in that is we can give them a CO alarm as a gift, exactly the same type of alarm as you'd buy in Tesco and say, look, we would like you to put this up, but you don't want us in the property, so we can't fit it. If they let us in the property, we'll do the full service.
Yeah, okay. Pat?
Yeah, on the PPE kit, Andrew, as well, we've spoken with the majority of our clients now. We've shown them and we've shared with them our costs for PPE on their contracts. Majority of clients have come back saying they're willing to cover the full costs. Some have come back saying they're willing to cover half. We'll negotiate. We always negotiate with our clients anyway. So there's nothing, you know, written in red that we're going to charge all the PPE costs against it.
Okay, that's great. So finally, into the presentation, and you know, conscious of time, but hopefully, audience, you'll bear with us for a few more minutes, and I'll now hand over to Keith Rogers, who category manager heating and renewables at Fusion21. Oh.
Okay, have I got control, Andrew?
You should have now.
Yep, great, thank you. Okay, as Andrew pointed out, I'm the category manager at Fusion21 for the heat and renewables. Thanks to all the previous speakers for their shared views and insights. Very difficult and testing times for the industry. Just bearing in mind the time, my intention is a quick overview of the current Fusion21 domestic contracts and a summary of our member activity. So at Fusion21, we have 36 Lot 1 domestic service and maintenance contracts. That's covering approximately 212,000 properties. They're not all big contracts. We range from 200 properties to up to 20,000 properties. And one of our groups has over 40,000 properties. The majority of our contracts are based on a 10-month rolling programme. And those in the industry obviously know that normally allows sufficient time for member access procedure and any subsequent legal procedure whilst taking all reasonable steps. Okay, within all of our Lot 1 contracts, it states that suppliers will provide benchmarking KPIs on a monthly basis on award of a Lot 1 contract. These have definitions within them which they can adhere to, so it's no grey area. So the definition, service compliance, is a percentage of the LGSRs within an anniversary date. So the number of domestic properties with a valid LGSR on the last day of a reporting month. And this isn't just for that month, it should be the rolling total for the year. So at the end of each month, the member has a view of where they are. We also ask that the contractor is giving us that information, but that information must be verified with the member also. So there's 2 operating systems. The member will have their system, the supplier will have their system. A lot of the systems are integrated, but if they're not, they must confirm that the data provided to Fusion21 is correct. And pleasingly for us, we can see the March figures there. 99.79 goes down slightly in April, goes down slightly in May. We compare it to last 2019 average. So we can see that it has gone down, but not by a lot. And these are all actual figures from our contracts. The main figures show several contracts at 100% compliance, with the lowest at 96.86. The interesting one from that compared to last year, for the month, is March. We had 22 contracts at 100%. In April, we had 13 contracts at 100%, and May, we only have 7 at 100%. So despite the good figures, there is a slight dip in the access. So our 9th KPI that they have to report on every month is first time access for servicing. So it's a number of properties where the supplier obtained access by their first service appointment. It's a letter or rebooked by a resident, because most people would send a letter out saying, returning that day, if you want to change, let us know. So this is normally a measure of how successful the lettering system is by the member and or the supplier. So for March, we've seen 67.76. April was a slight dip, but interestingly, it went up slightly in May. As we can see from the averages from 2019, there is a slight dip, but not too overly concerned about the access. So this demonstrates with the figures that we're showing on the KPI 1 of compliance that the second and third visits are working. So the suppliers currently carrying out Lot 1 contracts for us are listed there, and we renewed the Fusion21 framework, which went live in January 2020. This has 35 appointed suppliers over 40 regions for call-off or mini-comp. So an example of one of those contracts we just talked about, one of our long-standing members, High Peak Borough Council, maintained 5 years, 11 months of 100% LGSR. We're just hoping to get to that July, then it's 6 years, 100% compliance. This has been done with the Liberty Gas Group on a 10-month rolling contract. So Lee Smith has attributed the last 3 or 4 months on increased outbound calls to customers, explaining the legality of the annual service and also what precautions their engineers are actually taking when they're going to work in the resident's property. They've also increased the automated tech service to keep customers informed of appointments, long-standing patch engineers, risk assessment, and a close working relationship with High Peak have all helped to ensure this compliance was kept. Spoke to Jade Seddon the other day, and she said they've remained compliant due to the positive work by both Liberty and High Peak. She said it's not been easy, but they want to maintain this 100% compliance. So that's a pleasing flagship contract. So going on to the member activity, a lot of people have been concentrating on COVID and how they're going to approach it. However, since February the 17th, we've had in excess of 90 inquiries for the following lots. So lot 1 is what we talked about earlier, it's domestic service and maintenance. We've had inquiries for domestic heating installations. Lot 3, commercial service and maintenance, which is key to keeping compliance also. We've even had inquiries for commercial installations, so work is still carrying on. Lot 5, consultancy, this is probably the most sought after at the moment because post-lockdown, people are still going to want to be taking quality audits. They may want to look at a review of their procedures. So that covers, is covered under Lot 5. Lot 6 is design and project management in plant rooms. We've had inquiries for this, installation of air and ground source heat pumps, and Department for Education sector. We had in excess of 80 inquiries for that over January and February. There has been a slight dip in it now because of the education, the schools being shut, but it is still pleasing to see there is inquiries still coming through. So as I talked about there, the appointed suppliers to Lot 5, you can see at the bottom there, the scope of work covers in relation to electrical inspections, heating installations, investigative reports, policy reviews and training. So we've got 43 of these contracts on site, and we've had 8 to 10 inquiries over the last 2 weeks. So as you can see there, the appointed partners are there. We will be sending these slides out. And if anybody needs any more information on any of the lots under the heat and renewables category, please contact us and we can arrange a one-to-one chat and we can discuss any of the call-off arrangements.
Okay, thanks. Thanks very much, Keith, and thanks very much to the panel. I am conscious of time, and I can't see any final questions. So I'll just sort of wrap up and say, I think that's been a really interesting and great session. Clearly, the whole issue of resident safety and gas safety in particular has been paramount for everyone during the course of this crisis, and it's clear from all of our contributors that there have been some challenges, but it's really good. And I think the key message around all of this is continuing to communicate, both in terms of the communication between you, the organisation, whether that be housing association, local authority, with the customers, but also you with your contractors, and that working in partnership together is really, really important. If we haven't addressed any of the questions, we'll certainly pick any final ones up and get back to you in accordance. So I just want to again thank you, the audience, for listening. Thank our panelists and speakers for there. We do have another webinar coming up, which, as said at the beginning, is looking at compliance. You can get details on our website, but we'll also be sending out an invitation. So thank you for listening. Thank you to the panel, and look forward to hearing or seeing you all again soon. Thank you and goodbye.